Hi everyone. Hi Shay. Hi Marissa. Okay, we'll just let a few more people join and then we'll start today's session, okay? Okay, a few more minutes. Hopefully today we will not have any technical issues and you guys will be able to hear all of us. Okay, I'll let you know. Okay, Denise, I'm going to add you in a few minutes. Okay, let me just do a quick intro. Okay, one more minute and then we'll start today's session. Hi everyone, thanks for joining today's session. Okay, so today's session is about dealing with the grief of miscarriage, okay, dealing with difficulties in infertility and obviously knowing when to stop trying, okay. I think it's a topic that a lot of people are quite interested in because I mean, a lot of people have gone through this, okay, so that's why we decided that we wanted to bring a counsellor in. Denise Tong, who will be joining us today, is from Lithops Counselling. Okay, she is a counsellor and she'll give you guys an introduction of herself in a bit. Okay, as we in regards to every session, okay, although it's professionals giving us advice, but please do seek professional advice for your individual situation, okay, should you need it, okay, because everyone is unique and so the advice given is a generalized advice, so do please get personalized advice, okay. All right, so I'm gonna just invite Denise in and we will start today's session. Okay.
Hi, can you see me?
Yes. Hi, Denise. Okay.
Hi.
Can you hear me?
Yes, I can hear you.
Fantastic. Okay, so hi everyone. This is Denise Tong, okay, from Lithops Counselling. Denise, would you like to give us an introduction of yourself before we start?
Oh yes. But first, I'd like to apologize for the quite ghastly looking face.
Okay.
I've got this light, this circle light thing that's supposed to help me, but it's looking a bit strange. Please do not let this affect your your experience of tonight. Okay. I'm a counselor in private practice. Mm-hmm. And but today I'm not only going to talk in the capacity of like a professional, but also as a mother myself and a person who has been through a miscarriage. So I have a 5-year-old son. So when he was 2, I got pregnant again. Then it ended in a miscarriage, which was quite sad for me. So there was lots of grief then that I processed with the help of a counselor. So after that, I was so inspired. I went for my own counseling training, and now I'm a counselor, a full-fledged counselor. So, yeah.
So you became a counselor because of what you went through?
That's right.
Oh, okay. And so, so basically now, what type of people do you actually counsel? Is it only ladies, or who do you actually counsel?
So basically, I did my internship about 1.5 years in a psychiatric clinic. So the main bulk of my clients, my patients are those with anxiety, depression. Some of them have a little bit of psychosis or OCD. Yeah, those are my main bulk of patients. But I also do with grief and all that as well.
Understand. Yeah. So okay. So today's topic is basically dealing with the grief of miscarriage. I mean, I think that I think I did a bit of research just now. Apparently, 25% of pregnancies in Singapore end up in a miscarriage, which is technically 1 in every 4 ladies who get pregnant actually ends up in a miscarriage. Which I think, figures-wise, it's actually quite shocking to understand and know how many people actually suffer a miscarriage. Right. So, I mean, I myself have also had a miscarriage. I had my miscarriage at 12 weeks. I had a miscarriage where basically I was so excited. I went to the doctors. It was the day that I was going to find out the gender, and then the doctor said, we can't see a heartbeat anymore. So that's why then after that I had to go through 2 more weeks before I finally had the baby. I mean, yeah. So, but it was a very tough time. So that's why this topic today is very close to heart as well. Yeah.
Right. Yeah, thanks for sharing your story. Yes, I can really sense a lot of pain as you're sharing it.
Yes.
A lot of pain, a lot of disappointment. Yes, and I can relate to that because I have my own experience with miscarriage, and it was also around 11 weeks when I went for a scan, and the baby was only 6 weeks size, and the heartbeat was very weak. But every time I started to walk a bit, there's a little bit of bleeding, and then it was really looking very bad. But I was trying my best to, to hope for that, hope against hope that the baby would survive. So that 2 weeks wait is really the most painful.
It is. Absolutely. I remember Googling, is there such, I was just Googling constantly trying to figure out if the baby has no heartbeat, can they still survive? Things like that, because you're just not willing to accept the grief of it and this and that. Yeah.
That's right.
So, okay, so for the ladies who are, and I think that, okay, the word miscarriage and everything is something that is still very taboo, I think, in Singapore, or, I mean, it's not something that people openly talk about. And so when we realized that so many ladies, so having started this group, and we talked to so many ladies who tell us that they've actually had miscarriage, we realize in our group, there's so many of us who have gone through the same thing. And so that's why the talk today is really to let ladies know that it's okay to talk about it if you need to, right? Yeah. So, I mean, okay, let's come down to the sadness of a miscarriage. From your point of view, does the sadness of a miscarriage ever go away?
The sadness of miscarriage?
Yeah.
Okay. Well, at first it can be very intense.
Yeah.
Then it's sort of like, after it's processed, it sort of dies down and becomes a part of you. It will, in a way, like this grief that you have for your lost child will never really go away. Okay, think about it like a box. One of my friends who's a counselor shared this really great analogy with me. It's like a box. Okay, like maybe look at this tissue box, right? Inside the tissue box, there's a small little button. And there is a ball that's bouncing around the button in a very organic fashion. Sometimes it will hit that button and trigger the grief. So at the start, the ball bounces quite aggressively, but towards the end, it bounces less aggressively. So that is what grief is. It's a very organic thing. And even after many years, the pain and sadness can still be there. Like I remember after my miscarriage, about a few years on, my father came to my house and shared the story about this Korean drama that he's watching, about this small boy small boy is a spirit that was in the childcare, and he's always there. And when the mom comes and pick the kid up, everybody got someone to pick him up, except for
I think I watched that before.
Wow.
I remember.
I was really few years past my miscarriage, and I thought that wouldn't affect me, but it affected me. Now I was so debilitated. I had to go to the bed and just freeze. I couldn't move at all because I felt so sad that my child, the one that died at 11 weeks, is like that, lor. Somehow I'm not there to take care of him. Somehow it's like the child in the childcare, no one's picking him up. So that made me very, very sad. And that was already many years after the actual event.
Actual miscarriage. Yeah, I agree. I mean, same thing for me. Basically, I think that it's a lot of people, I think, guess people around you probably think that, it happened like last year, beginning of last year. So it's been a year, but it's still there. You still feel it, and you still often think about this child that could have been yours and this and that. Yeah. So would you be able to explain basically what is grief? I mean, are there different stages of grief, or what does a lady go through?
Okay, so I guess the most common and popularly known thing is, like you mentioned, the stages of grief, 5 stages. The first stage is denial, anger, bargaining, depression, and acceptance. So, okay, as we all know, denial is the first stage, which is like perhaps like when we go to the clinic and we scan and there's no heartbeat. A lot of us will still be in denial. Maybe just no heartbeat for a while. Maybe it's a bad scan. I will try to endure. I'll stay in bed. I won't move for 2 weeks, and maybe he will come back alive. So that's usually the first stage. Then the second stage is when you realize that, wow, you're going to go to DNC tomorrow and there's really no hope already, and you get very angry. This anger could be turned inwards. Like, why did I carry my elder son? Why did I carry those library books? Or it could be anger towards your husband. Why didn't you take better care of me? Why you ask me to do so many things when I'm pregnant? So that's the anger phase. The third phase is bargaining. Bargaining could take many forms, like, I pray, God, please, I promise you, if this baby stays alive, I'm going to go into charity work. I will donate all my money. That's bargaining, right? Finally, depression. Depression is like, there's no hope anymore. I just feel so hopeless and I feel so depressed. Finally, acceptance. Yeah, so it's not a very, you don't have to go through all 5 stages chronologically. You can jump between the stages. So
it doesn't have to be in that sequence. It can be in any type of sequence. Does it always end in acceptance?
It depends on how well this grief is processed. If you are really, it's well processed, you have a good therapist or good friend to talk to, you can actually move out and just land in the acceptance and stay there for a very good long time, you see, perhaps for the rest of your life. But if it's not well processed and possibly ignored, then you might find that okay, you accepted it, then next day you're angry again, then you're bargaining again. You know what I mean? So you're trapped in this cycle until it's really fully processed.
Understood. In terms of, let's say, how does a lady know that, okay, I think I need help, in terms of whether counseling or whatever help, but when does it come to a stage where I don't think I can deal with this myself and I need help?
Okay, I think because I work at a psychiatric clinic, in that clinic we have 3 main benchmarks to decide when you probably need some help. First is like you cannot sleep well, you cannot eat well, and you cannot do your daily functioning well. You can't even get yourself up from the bed to brush your teeth. So that's these 3. And if I can share with you this model about the dual process model of grief. Okay. So if you can see, in normal grief, right, there are most people, they can process their grief very well. I think more than 60% don't need any therapy. So they will be able to, let's say after the miscarriage, their life will be filled with loss-oriented events as well as...
Because the picture is inverted, okay? So maybe you could just explain a bit further. Yeah, it's inverted.
So, okay. So you just...
We will also share this picture in a slide as well after the talk. Okay. But you can talk about it,
Okay, so it's inverted, so you have to use a bit of imagination. So the loss-oriented events could be less like staying in bed, crying, grieving over your child. But you can't do that all day, right? You might get tired and then say, I'm going to go out to buy some lunch. Then I feel so miserable again. I feel like oh, God has failed me or what. And you're just stuck in bed again, or you're crying non-stop. Then I think maybe today I want to go and do my hair. So we always, normal people, normally we are able to oscillate between loss-oriented grief and restoration-oriented. So if you get stuck in either oval, like you're just grieving all day long and you never do anything to take care of yourself, to restore your former state of peace, then that is pathological grief. Similarly, if you're stuck in restoration event all day long, you're just like trying to get your life back in order and you never even acknowledge that you're sad. So that is also not good grief. You need to have both in order to have a healthy grieving.
Understand. So basically, it's normal to be in both and jump around from one side to the other side, is that it?
That's right. Even within a day or within weeks, you should be able to do both.
Understand. In terms of, let's say, so I think that this is talking about our own grief, okay, of ourselves going through a miscarriage. Let's say we have people around us going through a miscarriage, right? How do we support them? Or like, let's say we have family or friends going through an actual miscarriage, and say that, what should other things that we can say to them or help them and this and that? Because sometimes you feel very helpless,
That's right. And then see, like you mentioned, I really like your introduction. Like you say, everybody's different. It's true, everybody's different, and what they need is different. So it's good to ask them, what do you need from me? You know, some of them, most people just need a listening ear. Someone that will be able to sit there with you and listen to you. Even if you're going to cry in a very ugly face, they're going to not judge you. If you're going to get very angry, they won't judge you. You're just there for them. You don't need to say much. You just be there with them and support them. Give them the permission to express all their emotions. I think that would be very helpful for most people.
Understand. So, okay, coming back to, let's say, going through a miscarriage, when would I know I'm ready to try again after a miscarriage?
It really depends on you and also your husband. Like, both of you should be able to feel like, yes, my next child is a new independent child. I've already done my grieving for the one that I've lost. And this new child is not going to be a replacement of that child.
Yep.
We're going to move forward and have a new family member. And it is not a form of like like, okay, for example, like the restoration activity, right? It could be involved like, I'm going to restore, I'm going to get a new child. So it cannot be like I'm just going to get a new child to replace that one that I've lost.
Yes,
Then it's
yes.
not so fair. Like the rainbow baby thing, it's not so
Mm.
fair, because it's true that the baby that was lost, he deserves to be grieved as well. Yeah.
Understand. In terms of grief, right? Let's say, okay, because we always talk about the lady side, okay, the lady grieving and this and that. So obviously, husbands grieve as well, okay. But what happens when? How does a wife support the husband? Because obviously, we always think that the husband should be the one supporting the wife, but vice versa. How should it be?
I suppose, okay, let me share with you this story. Okay, when I was young, I was a PE teacher, so I brought my kids to rock climbing activity. So there was one child who was stuck at the top of the wall, and almost at the top, but he's just afraid to climb that last thing to ring the bell. So at the bottom, there was another child that was pulling a rope to support his weight, you see. So it was very late, we needed to go home. So there's a rock climbing instructor. He told this boy who was up there, said that, boy, why are you so eager to stay there? Don't you know that the person down here is busy supporting you, and he's so tired as well? I mean, you wouldn't get a prize even if you ring that bell. I think you should come down now, and next time just come back and climb again. So, okay, this is quite a good analogy, I feel, about the husband and wife role in pregnancy. Although the wife is doing the heavy lifting, climbing the wall, but the husband is at the bottom supporting.
Yeah.
So he's actually bearing quite a bit of brunt, right?
Correct.
So he has the right and he should have the permission to grieve as well.
Yeah.
And also because society, there's this thing called toxic masculinity. You're not allowed to cry.
Toxic. Yes.
Right. So like they can't cry to their friends and everything. So and you know what I mean, I still need to be strong to support my wife. So they don't have this this safe space to really grieve. So if there's any one of you here who is a husband grieving, a father grieving, yeah, you have the permission to. In fact, like the husband and the wife, right, both of them have nursing a dream of bringing this cute little baby into this world and taking care of this baby, nurturing him into an adult. So all that dream was dashed in the miscarriage. So of course the father has a right to grieve.
Yes, agree. So in terms of wife, basically, I think that as a woman, we should also understand that husbands grieve as well. I mean, because I think a lot of us probably think that you're not grieving as much as me, you know, because I'm the one going through, and obviously I'm the one going through the loss of the blood, the trauma of that, which comes down to the basically PTSD. Okay, do you think ladies will develop PTSD from a miscarriage?
Okay, from my understanding, PTSD, right, is at least DSM-4, one of the gatekeeping rules for PTSD is that you must have a life-threatening event. You must witness someone dying, or you yourself almost died. So I keep thinking to myself, is miscarriage under that category since you witnessed your child dying? I would like to believe, yes, it should be under this category, because it's so traumatic, especially for mothers who really perceive that unborn child as a real member of the family. So yes, you can have PTSD, you can feel really scared, and you can have flashbacks, intrusive thoughts, you have nightmares and all that. That would be PTSD. But typically PTSD will clear between 1 month and 1.5 for most people. But let's say if yours persists, these intrusive thoughts, the nightmares, the flashbacks keep persisting for 2 months or so, then perhaps it's time to see a counselor, a psychiatrist to get some help.
Understand. Okay. So let's come down to, I've lost a baby, or I've been trying for a baby, and obviously it's very hard for me to have a baby in that sense. How do I cope with jealousy? You know, I mean, when we see friends, family around us, they're getting pregnant very easily. You know, they're having babies, lots of kids, and this and that. How do we deal with the jealousy that we feel? Because I mean, it feels really horrible. We don't want to feel that way, but how do we manage that?
Yeah. Firstly, you must know that jealousy is quite normal, and everyone has it. So don't feel like you're a monster for being jealous. No, you're just being human. Yeah. And it's also true that it's just one small part of you that is jealous. There's other part of you that's very happy for them, that really wants them to prosper and multiply, right? So you don't judge yourself based on that small part that is jealous. As to how to manage it, it is always because we are complicated creatures, where there's a part that's jealous, there's a part that really wants to be a good friend or good family member to support the one who's pregnant or who just given birth, right? So that part will keep on trying to suppress the part that is jealous. Force yourself to put on a happy front when you visit them, to buy gifts and to overcompensate, maybe to have reaction formation to swing to the other extreme to be super nice when in fact you're very jealous. So that is not so healthy for your emotional health lah, huh? So if it's just too much, you have the permission to keep your distance from that person for a while until you resolve that jealous feelings. Yeah.
Okay. So it's okay to feel jealous. It's normal.
It's normal, just being human. I feel jealous all the time, man.
Yeah, I understand. I mean, at the end of the day, I think that it is important for us to know that it's okay. Yeah. And you're not, as you said, you're not a monster for feeling jealous, you know, at the end of the day.
Right.
Yes. Okay. Now let's get on to basically knowing when to stop trying. Okay. For I think a lot of people in our group basically suffer from infertility. Okay. So whether it's having a miscarriage or basically just being unable to get pregnant and have a child. Okay. How do we know when enough is enough?
Okay. Of course, this is the IVF group, right? So
yes.
When I was about to do this live dialogue session, I discussed this with another counselor friend, and he gave quite a good analogy. But it might be a bit, pardon, a bit offensive. If any of you are offended, I'm sorry. But okay, so he likened this almost like going to a casino, sitting in front of the slot machine and pulling the thing. You don't know when will you finally strike it big and then have a successful pregnancy, right? So yes. A lot of people, they walk into the casino, they sit in front of the machine, and they might stay there for hours and hours if they're not careful. So it's important that before you walk into the casino, you decide like, okay, I'm going to just be in the casino till 3 p.m. Then I'll go home, I'll pick up my child, I'll cook dinner. So 3 p.m. is a hard stop. I need to come out. Similarly, before you walk into the IVF clinic, it's good to sit down with your husband and decide how many times are we going to try. So, okay, maybe if you all decide 3 times. So if 3 times and it's still not successful and you're in front of the slot machine, it's very easy to buy reflex. Just pull again the 4th time, 5th time. But you have to resist that temptation. Walk out of the casino, take a couple of months off and really decide whether you're going to continue. I think that's very important.
That's a very interesting analogy. And I think it is very correct, because I think that it is important for couples to basically discuss this, because a lot of times I have certain friends who basically the wife wants to keep on going, okay, but financially it has become a problem, especially and it's something that as much as the husband wants to carry on as well, but financially not viable anymore. Okay, because obviously no subsidies, no nothing and this and that. So I mean, that's the thing where couples have to be on the same page. But what happens when there's a disagreement? So basically, wife wants to keep on going because I want a child. I don't care. I want a child. But the husband says, let's not. So what happens then?
So I think very important nestled within this question is this topic. I mean, this concept of a sunken cost theory. If you've been in front of the slot machine and you already spent a couple of tens of thousands on IVF, you want to bring back a baby, right? So okay, I'm going to just pull one more time, I'm going to bring back the baby and all the money will make sense. So either the husband or the wife, either party might be very keen to pull the slot one more time. But you must remember, like my analogy about the rock climbing, it is both parties. The one is climbing, the other one is holding the rope at the bottom. Both has to agree. Otherwise, right, you might sacrifice more than you're willing to. Not only the finances, so you might sacrifice the relationship. Yeah, yes. And if imagine you bring a new life into this world, but the husband and wife relationship isn't good, is it worth it? Will it be good for your child that's coming into the world? All these are important questions.
Understood. In terms of, okay, let's say both couples, the couple has decided, okay, it's time to stop, okay? But there are a lot of ladies who feel very guilty about this. How do they stop feeling guilty? Because in their mind, this pain doesn't go away. But how do they stop this pain, this guiltiness of deciding, okay, I'm going to stop?
See, when they decide to stop, they might feel guilty for several reasons. Maybe one reason is, spent so much money, wasted so much money. Or second reason is like, am I giving up on motherhood? Will I never ever be a mother? So they might feel like guilty for not trying hard enough, for giving up. You know what I mean? But the thing is, you have to think about it. You have options. You can either continue trying. First option, you continue trying. You keep draining your resources, drain your physical health, and strain the relationship within your husband. That's one option. Second option, you just cut your losses and focus on other good things in life. Which option do you want? So that can cut the guilt. Anyway, in life, there are so many different types of winning script. scripts. You don't only have to focus on that one winning script, is that I went for IVF. After 3 tries, I successfully brought home a baby, and that's my only winning script in life. It can be another script like, I went for IVF, I failed 3 times, and I know when to stop before I went crazy and went overboard. So I stopped, and I started focusing on other things in life. Like I put all my nurturing energy into becoming a teacher, becoming a Sunday school teacher, or volunteering at the orphanage. There's so many other ways to pour that devotion of that nurturance into.
Yes, because I guess as a woman, we always think that sometimes being a mother is our only plan in life. So when it comes down to not working out, basically we need to know that there's so much more to us than just being a mother.
That's right.
Right? Yeah. In terms of, okay, so let's say a lady, basically, let's come back to miscarriage. She's gone through a miscarriage, okay? But there's the anxiety that, let's say she's gone through 2 miscarriages, okay? She's pregnant again, very luckily pregnant again. So this is one of our followers actually. But she cannot stop worrying that she's going to miscarry again. So how does she stop? So it comes to anxiety. How do we stop anxiety?
Okay, so this, you're right, it's anxiety. And it's very common. Imagine that you lost two children, and then now you are having your 3rd one. You were thinking that it's going to repeat. It's almost a bit like the PTSD that I mentioned. You start to imagine that, oh my, the 3rd one is going to end in a miscarriage. Then you start to be anxious. So that's one level of discomfort and anxiety. The other level is that, my goodness, I have anxiety now. Will this anxiety actually contribute to the miscarriage? Am I being a bad mom for allowing myself to worry so much? So that actually even heightens the anxiety. So, okay, for them, I would say your thoughts will not affect the outcome of this baby. If they're Christian, I would say that the safety and the growth of this baby is 100% in the hands of God, and 0% in your thoughts. Your thought is just a thought. If you're anxious, you're just anxious. It's okay and it's normal.
Yeah.
Don't worry, it's not going to affect this baby. But if you're asking me for a coping method to cut the anxiety, I can teach you a bit about mindfulness. Okay. If I can have a self-indulgence, 5 minutes or 2 minutes.
Sure.
Mindfulness. Okay. Think about a white piece of paper. Okay. That is like our present right now is actually white. So, but sometimes our present might be contaminated by fears of the past, like sadness from the past, like grieving from the depression from losing a baby. So the pain of the past starts to bleed into the present, causing it to not be so white anymore. The anxiety of the future, like when I lose my child, starts to bleed in and starts to make the present very, contaminated as well. So this white piece of paper is now so bloody and no longer white, but in fact, if you think about it, right now you are safe and sound. Your baby is safe and sound. You're in a nice, comfortable, air-conditioned room. Everything is safe and sound. So the skill of mindfulness is to draw a barrier, make a wall, put a wall to prevent the past from bleeding in, or prevent the anxiety of the future from bleeding in into your white paper. That is to be in the present. So that can be cultivated through mindfulness, through meditation, and all that, which you can learn. Many videos on YouTube that you can learn about. Yeah.
Interesting. Okay, so basically, it's something that you have to do yourself, kind of thing, that you have to just kind of put a barrier and then stop those kind of thoughts.
It is like a muscle. The more you practice it, the stronger it becomes. Mindfulness is almost like, but you don't really have it yourself per se. Like, there are groups of people who meditate together. And there are people who teach you the philosophy of meditation and all that, of mindfulness, of really experiencing this world with your 5 senses, and not be too lost in the thoughts of the past or the future, but to just fixate yourself in the present. So that will really be quite good at ameliorating the stress that comes from anxiety or pregnancy anxiety.
Understood. That's very important to know. Okay, how about, so we had one follower who said that basically she's had a number of miscarriages, okay? She's feeling very low, but she's unable to cry anymore. There's no more tears. There's no more, basically, she feels so satisfied. But is this a stage where it comes down to she needs help, or is this normal as well?
Or it is like not able to cry anymore. It makes me feel that she had cried a lot already. She really cried a lot, right? Which means if you look back at the model, she was grieving so much under the loss-oriented events, and now she don't want to cry anymore. So I think that's normal. Let her do what she needs to do. She can go do her hair. She can go out for a good meal. She can go and do her manicure, pedicure. Anything she wants, she can do. She has the permission to do that. And when she's ready to cry again, then let her cry. That is just a normal grieving process.
Understood. So it's normal. Okay.
Yeah.
In terms of so coming back to disagreements or feeling guilty and everything. So we had a follower who says that basically the only reason she has to stop now is because it's no longer financially viable. But how does she stop the pain? Basically, it's been, I think she says it's been a year, okay? There's still pain. She cannot get over it, okay? What kind of help does she need in that sense?
So the question I have for her is what is so painful about it? What is the thought that was going through her mind when all the pain start getting stirred? Is it like I will never be a mom again?
Most likely.
Because I'm poor, I can't afford IVF and I probably won't conceive naturally, so I'll never be a mom again. My goodness, no, I'll never be a mom. If the thought is so strong, I'll never be a mom, the thing is, it may be a premature conclusion because you might still conceive naturally. That's one.
Okay.
And then also another thing about depression and then sometimes when people grieve too much, they tend to be tunnel vision. They just focus, like you mentioned just now, like women have to be a mother and that's like the whole of their world. It's not true. There's so many other beautiful things in life, right? So one way is to try to find out what other things are going on or that she likes. Before she had this dream of becoming a mother, what was her dream? What was the thing that was driving her in life? And then we try to find back that passion again. I think that will really help push her out of this space.
Understood. Yeah, I think that's quite true in that sense. So, okay, let's say, so somebody said, should I have to inform others when doing fertility treatments like IUI, IVF? But what happens, what do I tell people when it fails?
That's right. I think this is a very personal question. It depends on how much you want to disclose. It also depends on how much people want to know. Some people really are very uncomfortable. I don't tell me anything about miscarriage. Disgusting. Some people are like that. Okay, if they don't want to know, you don't tell them. It's quite it makes them uncomfortable. But if it's other people you talk about, it's like your father, your mother, your father-in-law, mother-in-law. Maybe they want to know because they are eager to get involved in your family planning and all that. You can tell them, and depends on their temperament, and also depends on their superstition. Some of them, like maybe Taoists or what, they might. Okay, sorry, no offense to all Taoists there. But some of them might believe that, like no, very superstitious. You miscarriage. You don't stay in my house the next 6 months. You move out first because you want bad luck. Then better you don't
really?
tell them.
Understand. So certain things are better to keep to yourself. Okay. There's another question that somebody sent to us recently. Is that basically how do I deal with the stress of going through fertility treatments while at work, when basically the office or everybody around me, like in the office, is basically saying that, oh, you shouldn't be taking so much time off, and it's giving her additional stress with work and this and that. So how does she deal with things like that?
So it seems like that lady has a lot on her plate. So if she wants to go through fertility treatment, she wants to get pregnant, but you know that stress can actually make the pregnancy more fragile, so to speak, right? So for her, if the work is really so demanding, she has choices. That she can either, first choice, stay in this job and try to explain to them that yes, I'm going through fertility treatment, try to be understanding. The other option is to get a job that's less stressful, or just to stop working for a while she is doing the fertility treatment. So she has options. It's up to her to weigh and evaluate what she wants.
Understand. So there are options. You're not basically stuck on one road and that's it, right? Yeah. Okay, somebody also asked, because you haven't actually gone through IVF, but is the grief of an IVF failure similar to a miscarriage? Let me answer this question. I'll use the analogy of your casino just now as well. So basically, I feel that an IVF failure is like going into a casino and basically putting money in to have a chance of winning a jackpot, right? But a miscarriage is basically you have won the jackpot, okay? You're happy for 1 hour or whatever, and then suddenly the casino comes to you and says, sorry, it was a mistake in the slot machine. We are unable to give you that jackpot money. So I think there is a difference. Grief-wise, I think that there is equal grief, but I think there's more grief in a miscarriage because you had it in your hands and then you didn't have it. So I think there is a difference.
Mm-hmm. You know,
Yeah.
interestingly, I like your analogy. And I like that you expanded on my metaphor. I love it. There's this story I read, you know, a live blog about this lady, a true story. She was pregnant for a while, but it happened to be that kind of like non-fertilized egg. Yeah, I mean that was growing, something like that. So after she lost that baby, she was so distraught, as if it is a real miscarriage. And everybody was telling her, it's just not even a real baby. There's not even the DNA of you and your husband.
Yes.
You don't have any right to be so depressed. And then so what she was experiencing is what we call disenfranchised grief, a grief that is not acceptable by society. But for her, because she thought that unfertilized egg thing was a baby, and she started to have all the dreams about like all of us who were pregnant and had miscarriage, of like cuddling the baby, nursing the baby, and all that, and all those dreams were dashed. So she experienced the same kind of grief. So I guess it really depends, you know, whether for the person, the husband or the wife who is going through it, what does this this failed IVF or this miscarriage mean to them? For some, right, even if it's a failed IVF, they might grieve a lot, and they have permission to do so.
Yeah. Interesting. Now I agree. Because I remember one of my friends, basically she got pregnant. Okay, or how to say? She tested positive today, and she suffered a miscarriage tomorrow. Okay, and so she lost the baby and everything. So, but it was only like maybe 5 weeks or something like that, because she just found out. And so we had other friends around saying that it's only one day. I mean, your baby wasn't even formed or in any way. What are you so upset for, and this and that? And so, and she is already a mother, but people kind of presume that you're not allowed to grieve, or I guess people are uncomfortable with grief to a certain extent.
Yeah, they are. First-hand experience of that.
So, I mean, in a situation like that, when somebody goes like, why are you grieving so much? Do you have to answer, or how should you answer? Because to not, basically, you still want to stay friends with them, but honestly, what they said kind of really pissed you off. So how should you deal with people like that?
We have no control over people's reaction and behavior. Some of them can be fairly insensitive, like the example you just shared. Like, you don't have a right to grieve. Only one day only you don't grieve. That is quite like finding coconut IVF, say ditch that friend. Yeah. Maybe you.
I agree. That's what I told her as well. I said I don't think you should stay friends with this person, but yeah.
So she has options. She can either stay friends with this person, but don't, because your grief is such a precious thing. You don't share with her anymore. You share with other people who can appreciate it, or you can just ditch the friend. You got these two options. Yeah, let her choose.
So there's always options in life, basically, at the end.
Yeah, that's right.
In terms of, okay, back to this topic, I mean, is there anything that you would like to share with our ladies in terms of your advice, or in terms of how to deal with stuff and this and that?
Deal with what? Sorry, I didn't get that.
Basically, how to deal with, I mean, everything that we're going through in terms of infertility and this and that. I mean, any advice to give to our followers?
Oh, okay. Advice is that anything in life, when you want it so much, it can lead to this thing called an obsession. Obsessions are things that when you have a tunnel vision, and I just want that, I'll do anything to get that, and that's so important in my life, and you just zoom into that. So when there's obsession, there's always pain and a lot of suffering. So it's important to take a step back and have detachment, and to look at the other things that in your life as well, to you know, instead of tunneling into having a baby, there's other things that's going on in your life too. How's the relationship with your husband? How's your relationship with your existing children? How's your job? You know, do you find your job meaningful and all that? So when you are detached and you can focus on all the other areas, then you won't less likely to get into an obsessive state.
Understand. Yeah. Understand. Okay, great. Thank you. As Cher said, yeah, it's an IVF black hole. Absolutely. I agree that it's an IVF black hole, because we have a lot of ladies. I mean, I know of a lady who has gone through IVF 7 times. Basically, finance-wise, depleted. They have spent all their money. They even sold their house to live with their in-laws just to fund an IVF, fund more IVF treatment. So it is really a black hole. And I think that And I know of certain ladies, certain friends who basically after deciding to let's stop for a while, it is much happier, you know. It's not something that, you know, it basically pulls you into a black hole. So knowing when to have a break, I think, is also very important.
That's right. That's right. You know, like I was thinking, it's very good to, before you even walk into the IVF clinic, you can write a letter to your future self, the one that has become very obsessed in front of the slot machine. You write a letter to her, say that, like, dear Denise, you know, there's so much more to life than just IVF and getting a successful IVF. There's still this, and all that. So that's just like your emergency insurance policy. If you ever get too obsessed, you can read that letter to yourself. That's going to be quite helpful and a wake-up call.
Interesting. Yeah, true. I mean, yeah, I never thought about it that way, but yeah, I guess so. I guess you are more reasonable or at the start of something, but in compared to after trying so much and putting so much money in, so much time, so much effort and this and that, you kind of need to know, okay, let's bring me back to where I started off and where I wanted to end this kind of thing.
That's right. And also sometimes you got to ask yourself, what do you want in life? What do you want? Some of them, they didn't even pause to ask themselves what they want. They just assume, what I want is one more baby. So when you get the one more baby, what do you really get? Now I feel that my family is complete. Okay, so now when you get that one more baby and you feel like your family is complete, how are you really satisfied? Well, I feel like I fulfilled my duty as a woman. Oh, okay, so does it mean that, so you get what I mean? So you realize that the root cause is that I
does it mean that's it in life?
Want to feel like a woman. Being a woman is to be able to have many children.
Yeah. So okay.
Sorry, you're breaking up.
How do you balance having hope for a success?
Yeah.
Can you hear me? Okay. So one of the ladies asked, how do you balance having hope for a successful cycle versus not having too much hope in case it ends in failure? So I guess what she means is that because at the start you have so much hope and everything, and then so how do you manage, like, being, should we be too hopeful or don't be too hopeful, that kind of thing?
Okay, this is very good question, because it's like it's almost a black and white thinking. You think about being 100% hopeful and then 100% pessimistic. Both are not so good, you know. Because you're 100% hopeful, you'll be so disappointed if you fail. Yeah. If you're 100% pessimistic, then you wouldn't possibly even try IVF. You just give up being a parent without even trying. So it's about joining forces and in the middle, find the middle gray area where you can realize that yes, I might succeed, but I might fail. But life is about taking risks, calculated risks. I decided I want to try 3 times, and that's my calculated risk. Beyond 3 times, I'm not going to try. And in these 3 times, I'll allow myself hope that it might succeed. So you keep yourself in the middle ground. You don't swing to overly optimistic or overly pessimistic. You keep yourself in the middle.
Understand. I guess that sometimes it's easier said than done, though, because, you know, I mean, we go through all this stuff. We put an embryo back into us and everything, and so the hope. But what I can say from my own personal point of view is that I guess the first few times you are very hopeful, but after being unsuccessful for a few times, then I guess hope just kind of dwindles down, and then you kind of just hope for the best but be prepared for the worst. So that's personally how I feel. Yeah, correct. Okay, there's another question. Okay, there's another question as well. Okay, how can you set a predetermined maximum number of tries? For example, let's say if they go into a casino, how do you know, like, how many times should I press this slot machine?
You know, by firstly, it's the financial resources. That's one thing that you need to consider, and also your health and your age and your existing children. Let's say if you've got a child that's in P6 or Sec 4 and you really need to devote energy to take care of them, there may not be a good time to continue your IVF in that year. So all these different factors you have to, you will know what.
For me, I guess it's time, age. Okay, that for myself, basically, I set myself to a certain age. By this age, you know, that's partly, and finances. Basically, I'm willing to spend this amount of money till this age. If I meet one of them at one point in time, that's it, I'm going to stop. So I guess this is something that you have to talk to your husband about as a couple to be on the same page as well. Because if you have one, different pages, like one on each page, it's not going to be easy, because I think with IVF and infertility, it's so stressful, and you need the support base. Your partner is the one that can give you the most support. Okay, and then following that, obviously friends, family, if you want them to let them know. And then obviously there's groups like ours where we hope that we can offer support to these ladies as well.
That's right. And then also you must consider the impact of your IVF, your ongoing IVF on the other family members. Like you sell your house, move back to your parents' place. And what's the impact on these two elderly now that they stay with you, your husband, and all your existing children, and now you're getting all the hormone injections for IVF, right? So you'll be more angsty, and then there's two elderly all in the same house. And what's the impact of that on your stress levels and all that? So all these things are important factors to take into account as well.
Yeah. So, okay, we had a lady said, how do you deal with insensitive comments from friends who have not undergone this journey and say the wrong things? Sometimes I feel it's better not to share with them.
I think it's very wise not to share with them at the moment, because you can't blame them also, because they haven't undergone this journey. They might say a lot of very hurtful things. I heard this, just an imaginary baby. It's not even real, it's imaginary. It's a real baby, man. To me, it's real. So you know what I mean? So people are going to say such things, so maybe it's not so good to share with them. Like support groups like fertility support is great, because there are other women on this journey. They will understand it and they'll be more sensitive.
Yeah, no, I totally agree. I mean, basically, I have very, very close family members who basically told me that maybe it's God's will that you shouldn't have another child. And then when I reply saying, I don't believe God will do that to me, then the rebuttal from another family member is that then you should believe in science. Science is telling you that you can't have another child. So it's very insensitive. I feel very, very hurt by those comments, but I guess they don't think that it's hurting. Yeah, so I mean, in situations like that, I guess I basically stop sharing with anybody that I feel is not good for me, basically. And I feel a lot happier not sharing. So the only people that I actually share with is actually you guys, all our followers and people in our group and everything. I don't share anything else with anybody at the end of the day, because I feel that I don't want to deal with these kind of people. I don't need them to tell me what I should or should not do, or how it will work out for me, because I guess I believe in myself in that sense. So I mean, same thing goes for Lily or Lindsay, right? At the end of the day, if you don't want to share, don't share. Okay, you can share with whoever you want to share with and you're comfortable with. Yeah,
that's right. Like sometimes they might come from a good place. They're trying to tell you, don't waste money and don't put your body through so much hardship. Just give up. I tell you, it's not God's will. And then science will say you cannot. You just give up. But for you, there's a part of you that I also want to give up, but I also want to have hope. I'm already in such a dilemma, such a hard place, and you're making it harder. I just can't take it anymore.
Yes.
So okay, if they're really making you feel that way, then you have the permission to just pull away.
Yeah.
But don't share about that.
Agree.
Yeah.
Okay, fantastic. I mean, any more questions, everybody? If not, that will be the end of today's session. Okay, let's wait a few minutes. Okay, doesn't seem to be. Okay, anyway, Denise, thank you so much. Okay, I think that it has been a very, very useful session, because I mean, this topic is very close to heart, and obviously it's a topic that we wanted to address because we have so many friends who are going through the same thing. Okay, we have one more question. I struggle sometimes to have sympathy for couples who are having problems to conceive a second or third child when I can't even have one. Is this normal? Totally. Very normal. Do you want to address this, Denise? Denise, you there?
Yeah. That's right. It's totally normal, and don't feel like you're a monster for feeling that way. But it is good. There's one part of you that's feeling like, I can't even have one child. They have 2-3 child to grieve until like that.
Yes.
They don't have this permission to grieve. Only I'm the only sole owner of this grief. Okay, there's this part of you, but I know there's another part that knows that everybody have a right to grieve, because especially those with existing children, when they lose the second child, they have the image of what it was like, like to nurse the first child and all that. They sort of project that onto the second and third child as well. So it becomes a very real experience losing a child. The grief is different from having no children and no experience with motherhood and then losing a child. So yes, they grieve in their own different ways, and all people deserve to have that right to grieve. But I understand why you feel that way. It's a bit of like, just now Kim shared the story about the jealousy, the envy. It's like that. And all of us, as long as we're human, we're going to be plagued with that. So you're not a monster. It's normal.
It's normal, yeah. And I want to say that, okay, basically because, I mean, I myself, I have two kids, you know, I have boys that I conceive naturally and everything. Coming to this group and starting this group with the other ladies, you know, there's also on my part, there's some sort of guilt, because, you know, when I talk about my story, I mean, I feel I'm very blessed to have two kids already, okay? And in the sense that I always feel a bit guilty sharing my story, because there are so many ladies who have not even had their first child. So, I mean, I'm very blessed in that sense. But this has given me more motivation to try to help these ladies as well, because I know what you guys are going through, and you guys are going through probably a lot worse than what we are going through. So, I mean, that's why the motivation to try to help as many people as possible is on our plate, yeah. But it's totally normal to feel that way, and it's okay to voice it out, you know.
Correct. And really, it's almost as if like you're starving to death, and other people will have something to eat, but they want something more, right?
Yeah.
So
correct.
What you're experiencing is very normal. You're not a monster. That's very important. You're not a monster.
Absolutely. All right. Okay. Thank you, ladies. Thank you, Denise. It has been a very useful session, and I think that at the end of the day, I mean, it's very good information for ladies. I mean, hopefully we can do another session with you sometime soon as well, regarding different forms of counseling and this and that, and then we can talk more then. But yeah, thank you so much for taking out your time to talk to us. And I mean, if we have any questions from the ladies, I will send them to you. Okay. And I'll also do up the slides for the graph that you showed in terms of the different types of grief, and we can share them as well.
Can. Or if you all have any questions, you can also email me. I will email you back. Yeah.
Okay. So, I mean, I've tagged Denise in our Instagram post, so you can actually contact her there as well. And then if you need basically any help or advice in this and that. All right. Okay. Thank you, everybody. Thank you. Good night. Thanks for taking your time out. We'll see you again next Thursday for a very interesting session. Wait, hold on. Let me see what's next Thursday is a new month. Okay. We haven't shared the new month's sessions. Okay. Next Thursday session is about sex. The importance of sex in infertility and how to basically feel sexy again. So that's another interesting topic that we are going to address next week. All right. Thank you, Denise, and have a very good night.
Good night.
Okay, bye-bye.
Thank you.
Good night. Bye.